Good evening. On behalf of Alpha Phi Alpha Fraternity Incorporated and General President Dr. Willis Lanzer, I am Dr. Jeffrey Sterling, the Surgeon General of Alpha Phi Alpha. I want to welcome you and thank you for joining us in this inaugural webinar of the Surgeon General Initiative for the fraternity. What we're going to be doing every Thursday for the foreseeable future is offering you information that is meant to empower you and give you the tools to be better stewards of your health. This evening, I am very pleased to be joined by our Deputy Surgeon General, Dr. Torrence Brown, who is notable, very much so, for dedicating his life to actually trying to improve the nation's health and healthcare systems through research and the development and implementation of successful public health programs. He is currently the Division Director for State Programs with the U.S. Department of Health and Human Services Center for Substance Abuse Prevention at the Substance Abuse and Mental Health Services Administration. He will be our moderator for this evening, and I trust that you will enjoy the offerings that we have to bring you this evening. With no further ado, Brother Torrence Brown.
Thank you, Brother Surgeon General. And brothers, again, welcome to the inaugural webinar to kick off the Alpha Phi Alpha Fraternity Surgeon General's Initiative. I am excited to serve as the Deputy Surgeon General for Public Health under the Surgeon General's Initiative, and I am pleased to moderate today's panel discussion on behalf of the brothers who make up the Public Health Committee. We'll kick it off with some ground rules. Brothers, for today's presentation, we will devote 40 to 45 minutes to the moderator-led questions. Brothers are encouraged to post questions using the chat feature. The panelists and brothers from the Surgeon General's Initiative will provide responses to questions at the conclusion of the moderator-led discussion. We will conclude the formal program, and then the panelists and brothers from the Surgeon General's Initiative will provide answers to each of your questions in the chat until around 8:15. Brothers, before we jump into tonight's webinar, let us take a moment to pause in silent reflection to remember the brothers and family members that we've lost to COVID-19 pandemic. Thank you. Brothers, we are truly in extraordinary times with the arrival of the COVID-19 pandemic and the resulting variants. The pandemic has left a catastrophic death toll in its wake, and the pandemic implications have disproportionately impacted minority communities, especially the African-American community. The COVID-19 vaccine has been in distribution since December of 2020. Although scientifically the vaccine has proven to be both safe and effective, it has not been well accepted and received by all members of the community. Recognizing that there is a storied history of medical mistrust, a barrage of misinformation, evolving science, and looming disparities in health literacy, we all have gathered to engage in some rich and meaningful discussion about immunization facts and implications for the brotherhood and for the African-American community. Joining me as part of today's panel are three accomplished brothers of Alpha Phi Alpha Fraternity Incorporated. Brother Bernard Scavella. Brother Scavella is a registered pharmacist with more than 45 years of healthcare experience in hospital and ambulatory services. Brother Scavella is a certified in pharmacy-based immunization delivery. He is currently the CEO of Healthcare Management LLC, South Holland, Illinois. He is the former Deputy Hospital Director for Support Services at the John H. Stroger Jr. Hospital of Cook County, and the former General Manager of ChemRx Chicago Long-Term Care Pharmacy. Brother Scavella was initiated at Xi Lambda Chapter number 113 in Chicago, Illinois, and has been a life member of Alpha Phi Alpha Fraternity since 2006. Brother Genson Hall is an assistant professor of medicine and nephrology at Duke University School of Medicine. He received his MD and PhD degrees at the University of Maryland at Baltimore School of Medicine and completed his internal medicine residency in nephrology and fellowship training at Duke University. He is faculty at the Duke Molecular Physiology Institute, where his laboratory focuses on the genetics of inherited kidney diseases, with a special focus on protein wasting kidney diseases that disproportionately impact African Americans. Brother Hall is a member of the Beta Theta Lambda chapter. And lastly, Brother Fred Earl Kinsey, Jr. He's a board certified emergency physician and a native of Jackson, Mississippi, who is passionate about men's health. He received a Bachelor's of Science in Biology from Alcorn State University and his medical degree from the University of South Alabama College of Medicine in Mobile, Alabama. Brother Kinsey proudly served in the United States Navy for 4 years. He completed his emergency medicine residency at the University of Mississippi Medical Center. He currently serves as a community emergency physician at Baptist Hospital in Jackson, Mississippi, and is an assistant professor of emergency medicine at the University of Mississippi Medical Center. He is a life member of Alpha Phi Alpha Fraternity Incorporated. Brothers, thank you and welcome. Our discussion will focus in two main areas this evening, and maybe three given the time, but these include vaccinations and implications for COVID-19. Questions will be posed in general to the panelists. Each panelist will be allowed to provide a response as appropriate as the question is answered. Brothers in the audience are encouraged to place questions in the chat and to share this information with family and friends. On the topic of vaccinations, according to the CDC, universal vaccination is a critical part of quality health care and should be accomplished through routine and catch-up vaccinations provided in physicians' offices, public health clinics, and other appropriate settings. In the US, vaccination programs have eliminated many preventable diseases and markedly reduced the incidence of others. According to the CDC, the most substantial barrier to vaccination coverage is lack of knowledge about these vaccines among adult patients and adult providers. Brother Scavella, I want you to start us off here to sort of level set the conversation. If you could tell us what is the difference between vaccines and vaccinations and vaccines and immunizations.
Very good. Thank you, Brother Brown. Vaccination is the act of introducing a vaccine into the body to produce immunity to a specific disease. Immunization is the process by which a person becomes protected against a disease through vaccination. Now, both of these phrases are actually used interchangeably because they go one hand in hand because of the fact that once a vaccine is administered to a person to create immunity, for example, if you take a look at the polio vaccine was administered to infants and children that were not immune, that did not receive immunity to that disease and had a high risk of contracting the disease. So the act of introducing a vaccine to the body to produce immunity to a specific disease is the actual purpose of the vaccines.
Awesome. Thank you, Brother Scavella. Brother Hall, anything to add to that definition provided by Brother Scavella?
Actually, I think it's a perfect definition, perfect presentation. The one thing I would just add is, broadly, you can become immunized by a number of different means, through vaccination, through direct infection. The advantage of a vaccine is that it is a preparing dose of the threat that you face from full infection without the consequences of having the full virus attack your immune system, enter your body and challenge your immune system. So it's in a way an opportunity to practice ahead of the actual test. That's what you want, is the ability to build a defense so that if you do run into active infection, or at least if you do run into contact with the virus, that you already have a prepared means of putting the virus down. That would account for some of the milder infections, the experience of people having less robust symptoms during a breakthrough infection, which we're hearing more about with the Delta virus. People who have gotten vaccinated did get the Delta virus, or the Delta variant, but then had reduced symptomology because they had built up a defense prior to encountering the virus.
Thanks, Brother Hall. That's important. That's important information, important for people to digest, which leads to the next point of discussion related to knowledge around vaccines and immunization and the use of them interchangeably. In 2016, there was a community health needs assessment published. One of the key findings was that community residents lack knowledge of or how to use available resources. In particular, the findings point to the healthcare system is challenging to navigate, and provider support services need more coordination. There are services available, but they are perceived as underutilized because residents do not know how to locate or use them. That being said, there's tons of information out there now on the internet, on the news, on the television, and some of it is true, some of it is we know is false. Where do you recommend folks go for up-to-date information about vaccines and increase their knowledge and information specific to vaccines and immunization? Brother Kinsey, could you address that, please?
Definitely. Thank you for having me here. I tell patients all the time that the CDC has the best and most up-to-date information related to vaccines. If you have a question, go to the CDC's website. I mean, if you've thought about the question, someone else has, and they've already put an answer to that question on their website. Another location that you can go to that gives excellent information. If you go to Google and type in NIH, and then if you have a question or concern or thought about this medication, does it work for COVID? If there has been research done on it, they're going to have that information there for you. If you type in NIH ivermectin, if you type in NIH Decadron, all these different NIH vitamin C COVID, if you type in any of these informations, there's going to be an NIH website that's going to give you very good information. Is this medication safe? Is this medication effective? Are there research studies going on right now to see if these medications are going to be safe and effective? It is all there, and it is trusted research science data. It is where I go for information. It's where I send my patients for information. It's where I send my family members for information because it is accurate, it is up to date, and it's put in there by scientists.
Thank you, Brother Kinsey. You bring up another good point that there are places that you can go to get reputable information. CDC, NIH, both reputable sources that provide accurate information. And also, just in terms of the reputability of the information, what is it that we need to know and understand related to vaccine safety in the FDA approval process? Brother Hall, could you address that question, please?
Yes. So I would just add one last little piece. The vaccines that are currently under emergency use authorization, the Pfizer, Moderna, and J&J, you can actually visit the websites for those companies and find out the curated, up-to-date performance data on the vaccines if you have questions or concerns about any of the ways that the companies handled the information. There are ways to get in contact with representatives through those sites as well. As for the FDA and the approval process, I think what is unique about this situation is that this is the first time a vaccine was approved through the emergency use authorization process for widespread use. The necessity was because of the emergence of the threat, how quickly it was moving, and the absence of any other tools to deal with this effectively. If you remember in the early days, we didn't have good treatments for COVID, and there was a lot of information floating around about treatments that had not been tested, that were being advocated for by people with questionable backgrounds in science and medicine. So it became necessary for purposes of containing the spread of the disease in the population to evoke the emergency use authorization in the way that it did. What that meant was that the trial data, the manufacturing data, the component data for assembly of the vaccine and distribution, all of those mechanical and practical concepts that each company had and produced data on to approach the FDA for approval had to be presented. And the FDA did its own testing with samples that were made available from the companies and from the individual testing scenarios to satisfy themselves that this would be safe to use in the public. What's important to remember is that once the emergency use authorization approval was offered, that wasn't the end of it. There were continual monitoring and observation of patients who were in the early phase clinical trials. There still is even now. This is how we are getting the information about when to possibly give a third dose of a vaccine. And they also held the companies to account for issues around manufacturing, quality control, distribution. It wasn't just sort of, okay, now you have the authorization, go do what you want. Each step of this process was heavily regulated. The ongoing distribution of vaccines to the population is also being studied. So this is a population-wide performance exercise for the vaccine. So people are collecting data on everyone that gets the vaccine. Are they reporting symptoms? Are they coming back into the clinics and showing up with, reactions to the vaccine? All of this data is being accumulated so that there's more information now than even when the emergency use authorization was provided for how safe and efficacious the vaccine is. The full authorization process takes into account all of the data that's been accumulated since the EUA was issued. And that's what's being used to make recommendations for full approval. So the full approval process means that the entire process of manufacture, distribution, observation, reporting that has gone on over the past year, in addition to tests that are done alongside by representatives of the federal government, all of that data in aggregate has satisfied the basic quality points that are necessary to grant full approval for any medication for the FDA. And it's going to take, this phase of it is taking as long as it usually takes. They have accelerated in the case of Pfizer, but it's not acceleration in terms of months, it's more in terms of weeks. And the most recent estimates when full approval should be offered sometime in the late summer, early fall. So thinking about the September timeframe.
Awesome. So we touched on a lot of different resources. There was mention of use accessing the J&J, Moderna, and Pfizer's website, accessing the CDC's website, accessing the NIH website. So there's tons of information out there. How do we start to begin to navigate all this information and then sort of help people make decisions that help people make good decisions given all the information, all of the resources? I know it can be confusing and daunting to take a look at all this information. So how do we help people sort of start making use of this information in a way that's digestible? Brother Kinsey, you jump in there.
Okay. So like I said a little bit earlier, one thing is don't follow information that somebody texts you on their phone. Don't follow information that somebody's sharing from an unknown website on Facebook or Instagram or Twitter. There are very reputable sites that we've discussed that will give you all the information that you need. And they will give you the reasons behind some of the changes for recommendations that we've given. And one specific one that I can speak on is when the Delta variant first came, there was a huge discussion that, and this became policy, that if you had been vaccinated, you didn't need a mask, that you could go maskless. And that data was based on research from COVID original, COVID alpha, COVID beta, because we knew that folks who got vaccinated, even if they carry some viral load, some viral particles in their nostrils, that viral load was significantly lower than persons who were not vaccinated. So given that research, we were able to say, hey, if you've been vaccinated, then you don't need a mask, because even if you're asymptomatic, the likelihood of you being able to pass this on to someone else is pretty low. But what happened, because we were having continual research, continuous data, when Delta came along, we realized that even if you're vaccinated, the viral load inside of the nostrils is just as high as the viral load in a person who's not vaccinated. So we had a changing of recommendations. And you're going to see that when you have a fluid situation like we have right now. So don't get discouraged when you hear, things change one way one day and then another way a different day. That should be reassuring. That means that somebody is watching things. Somebody is changing these recommendations based on the most up-to-date data. So when it changes, that's positive. That's not bad. That's not something that you should look down on, something that you should be upset about. that means that somebody for your health and your welfare is looking at the data and is saying, hey, let's adjust course. What we thought was working on COVID alpha is very different than COVID delta. And all of these different types of information, like we discussed, the manufacturers' websites of the vaccines, the CDC, and the NIH, they will get you where you need to be. And then if those sites aren't giving you the information, talk to your healthcare provider, talk to your primary care physician, talk to the physicians in your family, email the brothers here on this panel right now. I get emails, I get messages on Instagram all the time from people I don't even know, asking me questions, because as a healthcare provider, as a person who works in the ER that sees multiple COVID patients each day, you know, I'm probably the closest thing they have to an expert in this field. And if that means me giving you the information means that you're going to make the decision to get vaccinated, or you're going to, you know, talk someone else into getting vaccinated and just need that little bit of more information to do it, I'm open. Let's have that conversation all day, every day, because I want to see less people getting severely ill from this disease.
Thank you, Brother Kinsey. Brother Hall, we're going to sort of wrap up this conversation on vaccines, but I want to get into sort of the takeaway points for this particular topic on vaccines. Could you sort of break them down for us just in terms of the main ideas or the takeaway points for the brothers related to this topic on vaccines?
Yeah. So I think it's important to remember a few things from all that we've discussed. The CDC website that was up earlier, it ran in the Chiron, is probably the best place to go for a comprehensive, daily updated information curated by scientists or health professionals. That's where you should start with any search. After that, I would say limit your sources to just a few. The information is changing so quickly that, as Brother Kinsey said, adding maybe a discussion with a healthcare professional like himself or me or Brother Scavella, anyone who you have access to that could give you reliable information, I think would be the best way to do it, and just follow what's going on the CDC website. The other thing is to just say that the vaccines were developed and information about SARS-CoV-2, the coronavirus family, has been ongoing for more than a decade. The scientists who were focused on developing the mRNA technology have been working on that for more than 6 years prior to the launch in this format. So this is not something that came about rapidly. It happened quickly in the course of the year, but by assembling tools that were already developed. It was like you going to the kitchen and pulling down ingredients that were already in your cabinet to make a new meal. That's essentially what happened. These things were not all fabricated out of thin air. The FDA will provide full approval, most likely in the early part of the fall, late part of the summer. But the EUA was an emergency authorization so that we could get the vaccine out to the public and tamp down the spread of the virus. Both of the mRNA vaccines are exceedingly well performing in terms of keeping you out of the hospital, keep you from dying from COVID. And, in early studies, there were no deaths reported in the United States from taking any of these vaccines. Since then, you hear a few anecdotal cases of problems here and there, but the overwhelming symptom set are mild symptoms related to any sort of vaccine that you would get of this type. And, recent efforts to kind of boost diversity in the studies that tested the viruses actually did work this time. So for both the Moderna and Pfizer vaccines, we had enormous African-American participation, particularly African-American males. The representation in the studies for both companies was about 10%. We're about 13% roughly in the population. So it fell under that level. When you get ethnic groups, races involved in clinical trials, you want them at their level in the population. But Johnson & Johnson was able to recruit 13% African-American participants in their trial study. But overall, 10% was fantastic given the amount of skepticism that existed in the community at that time. So we really did overcome that hurdle. the key is informing yourself, staying informed, ask questions when you have them, but go to reputable sources. Don't waste your time or confuse the landscape by consulting Facebook as your primary source for information.
Awesome. Thank you, Brother Hall, for wrapping that up. And then we're moving into a little more discussion on COVID, specifically moving from the vaccine discussion. According to the CDC, a pandemic is used to describe a disease that has spread across many countries and affects many people. An epidemic is a rise in the number of cases of a disease beyond what is normally expected in a geographical area. In the past few decades, there have been a few public health epidemics that have garnered our attention, including SARS, MERS, H1N1, Ebola, Zika, and now COVID-19. Given what we know today about past public health epidemics, how is COVID-19 different from any of the recent public health and medical challenges that we've seen in recent years? Brother Kinsey, can you address that?
Most definitely. So we've had a lot of endemics, epidemics. If you go to one thing I did the research just was just Wikipedia and just Google the list of epidemics, and you'll see that each year there are tons of epidemics happening, whether it be between yellow fever, whether it's cholera, dengue fever, influenza, malaria. There's things happening all the time. You will have to go pretty far back, and let's just say we're looking at the number of deaths due to this issue. You would have to go pretty far back in order to find anything close to the number of people that have died or been affected to COVID-19. It is by far one of the worst pandemics we've ever had. The number of people affected, the number of people who will be affected, and then the long-term issues that people are having even when they survive the infection. We're used to seeing things like influenza. You get it, you're sick, and you're fine most of the time, 99.999% of the time. But with COVID, we're seeing so many times where people have COVID and then they come back with heart failure. They're coming back with, some have had loss of taste and smell for months. Some are coming back with another round of COVID. So this pandemic, this virus is just so much different than what we've ever seen before, at least in this modern age.
Awesome. Thank you, Brother Kinsey. Considering what we know about COVID-19 at this moment, and given that we know that the flu season is quickly approaching, what foundational knowledge and information should we be mindful of related to the flu vaccine and COVID-19 this year? Brother Scavella, could you address that question?
Certainly. The difference between COVID-19 and the flu is the flu season is actually, I would say, between October through May of any given year. And usually it might even extend a little further than that, depending. But when it comes to COVID, it's not seasonal. COVID is 365 the entire year. And you're going to be subject to it if you don't protect yourself, if you don't wear a mask, if you don't get the vaccine, the distance. You can be around someone and you can wait and get your COVID vaccine shot and think that you're going to be immune, because it takes 2 to 3 weeks before it builds up enough immunities to actually fight the disease.
Awesome. Thank you, Brother Scavella. Brother Hall, anything to add to that regarding flu season?
Yeah, so I will take this opportunity to make the case. Please go and get your flu vaccine. Just because COVID's here and it's the only thing people are talking about doesn't mean that other viruses don't exist. for the sake of your children, elderly family members, anyone who in your orbit does not have the ability to take the vaccine, please make sure that you help protect them by taking your flu vaccine. In addition to COVID, if you have no medical restrictions. I would say about the general way that influenza and COVID operate, they are both RNA viruses. But the problem with influenza, the reason why we have to get a shot every year, is because the way that the influenza virus manages its DNA or its genome, the coding that makes it what it is very random, and it's not spell checked, if you will. So that creates a lot of potential for mutation and swapping out. And so one vaccine, last year's vaccine for influenza, is not going to help us for this year's version of the virus. So we need reimmunization to protect us against the coming threat. So that's why you need seasonal influenza vaccine. The saving grace for us with COVID-19 that I don't know will always be present is the fact that it is a virus that spell checks. So even though its genome is smaller and it can manage, it can swap things in and out, there's a certain fidelity to the code that it wants to maintain so that it doesn't have these fatal errors that cause the viral particle to just die off. So that spell checking function is what's saving us, because it makes the virus kind of stick to a script, if you will. It can only drift so far away from that script under its current formula or its current way that it operates. I don't know if there's a potential for escape from that. For instance, that it could somehow be more like influenza by doing less spell checking and allowing for more random mutation. I don't know. That hasn't been demonstrated. But for right now, that's what's protecting us. Even with that, it mutates about half the rate of the flu virus. And we've already seen it change from the original Wuhan isolate that we first encountered, all the way now to Delta and Delta Plus, which are much more transmissible. So this thing can clearly learn and adapt. And every immune system that it encounters is an opportunity for it to learn and to get stronger and to figure out ways around the challenges that our human defenses put up against it. So the thing to remember is that while you're focused on the inconvenience of the mask wearing and the inconvenience of having to consider taking this vaccine, an enemy that wants to inhabit your body is changing and evolving in its ability to do so and to do so more effectively. It has an ability now to transfer from human to human at a greater rate than it did when we first saw the Wuhan isolate. It has, in some cases, it can produce more harm to the body. There are more severe cases. And we're now starting to see more pediatric cases coming out in all this. So there's really an opportunity for Alpha to lead here, both by holding up correct information for the public to consume and being the standard bearers in that regard, but also to lead in terms of demonstrating the public health behaviors that help keep everyone safe. So, I think that it's really important not only to understand the nature of the threat, but also to understand what our role could potentially be in leading people to a better set of choices.
Thank you, Brother Hall. Brother Hall mentioned the adaptability of this virus and how it morphs and changes. Brother Kinsey, can you speak to why it's still so very important to wear our masks, practice social distancing, and all those public health preventive behaviors, and why they're important still, and why we should still implement those? You're on mute, Brother Kinsey.
All right. Brother Hall touched on it. And in the medical world, the way we discuss how contagious something is or how easy it is to spread is a word called R naught. It's R and a 0. And it tells us how infectious something is, okay? So on the original coronavirus, the original COVID virus from Wuhan, it had an R naught of 2.5. What that means is that for each person that gets that variant of the virus, they are, by average, going to infect 2.5 other people, okay? That's statistically how that works. The R naught for Delta is 8. It is that much more contagious. In that same small environment, that the original one would have only infected 2.5 other people. Now we have a virus, a variant, that will infect almost 3 times, over 3 times the number of people. So that means that we have to be that much more cognizant of what we're doing in public. We have to always be washing hands. We have to shake hands a lot less. We have to wear our masks to decrease the number of aerosolized particles coming out of your mouth. I tell my patients all the time, especially the ones who are not vaccinated, with this variant and how contagious it is, it's not a question of, will I get corona? That question is gone. The question is, when I get corona, will my body be prepared to fight? Or is it going to have to spend the first 10 days learning how to fight? Personally, I want to be able to go into the fight ready to kick, ready to go. I don't want my body trying to learn this beast while it's whooping my butt. And that's what we have to realize. That is what the vaccines do for us. They give us this lesson in whooping butt, or they give us this lesson early so that when the fight comes, we're ready. And that's the opportunity we have now. And it is that much more important that you wear your mask, that you clean your hands. Wear your mask, clean your hands. Wear your mask, clean your hands.
Awesome. Thank you, Brother Kinsey. Those are great takeaway points for this portion of the discussion. Making sure that you wear your masks, make sure that you wash your hands, make sure you're social distancing. Still, those practices are still instrumental and helpful in preventing the spread. So, absolutely. We are coming up on the closeout portion of our moderated discussion. I don't know, panelists, we set aside some time at the end to answer questions in the chat. I don't know if you want to address some of those questions now, or if you just want to just trying to maybe we can take a couple of the questions in the chat, since we have a little time and we're ahead of schedule, and we'll take a couple of these questions. If it looks like some of them may have already been answered here, but it appears that COVID health effects are worse on Black general population than white. Is there a pre-existing condition that is more common in Blacks versus whites that makes us more vulnerable when we get it? Brother Hall, you want to take that question?
Yeah, I think there are a combination of things. There's nothing that has emerged as say, for instance, a genetic predisposition or any sort of inherent trait specific to Black people that makes us more likely or susceptible to the worst outcomes from COVID disease. I think what is important to remember is that this is, in medicine, there's a testing strategy called a stress test. And what that is when you're searching for something, for instance, in the heart, that might be a problem, and you can't pick it up on the general physical exam, listening with the stethoscope or checking in blood work. What you can do is you can put a person on a treadmill and make them walk or run to put demand on the heart. And that sometimes will produce the pain or the performance irregularity that signals both the area where the heart is injured or has a defect, and what impact that will have should that defect manifest later. The corollary to COVID is that the overwhelming nature of this process, the all of the components, the evolution of it, the pace of it, no treatment for it initially, exposed deficiencies in the society that need to be fixed in order to protect the most vulnerable. It's important to remember, particularly when you're making you're putting your thoughts together about how you vote, that the way you vote impacts the quality of your own health. And there's no clearer demonstration than this. This pandemic is dragging out because the most vulnerable among us, and there are so many more vulnerable people than there are people who aren't vulnerable in this society. But those vulnerable people, one, aren't fully protected and have, in a lot of ways, become so skeptical of the intentions for delivering care that they're not even taking the treatment when the treatment's available. So when 80% of the people in the boat are vulnerable and only 20% of that 80% is willing to take the necessary steps to protect themselves, that puts everybody else in the boat in jeopardy, even people who've gone out and gotten the vaccine. If this pandemic is allowed to march on the way it has, the vaccinated people may ultimately end up losing those protections that the vaccine afforded them. So we really are in all of this together. And while it might show up first in vulnerable people like African Americans, Native Americans, who actually do worse with this than we do, it ultimately will impact everyone. And that's part of the message, I think, that really needs to be highlighted to kind of unify the approach to kind of tackling this and putting it down as quickly as possible.
Thanks, Brother Hall. We have another question. If you've been vaccinated and are a breakthrough candidate and obtain the Delta variant with minimal symptoms, does your immune system build up a natural defense to the Delta variant should the vaccine wane over time? Brother Kinsey, do you want to take that?
Yeah, I think Dr. Jeffrey Sterling already answered that one in the chat. Somewhere over to the side or down below, but there's still a lot of data that's going into that. The idea is that anytime that you're exposed to these viruses, your body learns the protein coding. If it changes, obviously it has from Wuhan version to Alpha to Beta to Delta. Your body, your immune system learns these different protein codings. It goes back to your cells. It creates antibodies against it so that next time it sees it, it is better prepared to handle that fight, essentially. So the idea is, yes, each time you're exposed to a different variant, your immune system should be better capable of taking care of the problem if it sees that version again.
Awesome. Thank you. Thank you, Brother Kinsey. It looks like some of the questions are being answered in the chat by some of the brothers, so we won't continue to go through those. We'll actually get ready to wrap up so that we could then
there was one question that I saw that I did want to discuss. I think I guess it was a Ruffin. He asked a question about vaccine safety and how fast they are produced. I saw that question somewhere. Someone asked that question. There's this misconception that when vaccines are produced, that they take all these years to get approval. Okay, that we move this timeline so fast that it's just never been done like this before. Well, true, like Dr. Hall mentioned, we've never used the EUA to approve a vaccination because we've never had, at least in modern times, a need to. Because normally, I mean, we created most of our vaccines a very long time ago. So the need to just update them because of ever changing anything just hasn't been here. But we have changed, let's say, like the pneumococcal vaccine, Prevnar 13. It was presented, it's also a Pfizer medication. It was presented to the FDA in March of 2009. It was approved, fully approved, in February of 2010. That is an average of what time it takes for vaccines to be approved. Somewhere between when they give them that biologics application license, which is what it's called when anyone tries to get a drug or vaccine approved, it usually takes about 8 months to 12 months for the FDA to render a decision. Sometimes they'll say, go back to the drawing board. You had too many of this kind of reaction, too many of this type of reaction. You need to clean up the drug. Maybe that'll happen. But for the majority of things that they're going to approve, it happens between 8 and 12 months. So the timeline that we're using now, though a little bit faster than what's the average, this is what the FDA does. And understand that right now, COVID is the priority. That means that what would take, 2 weeks of meetings, because one meeting was every Monday to happen, now they're given 24 hours a day dedication to going through the data, of going through every piece of data to ensure that the product that they put out is safe for everybody. And we know it is. It's already been injected 5 billion times. We've given out 5 billion doses of vaccines. So, if there was going to be a horrible problem with these vaccinations, we would know by now. And I've had a question too about an example I use about safety when it comes to vaccines. Think about the Johnson & Johnson vaccination. We had 8 documented cases of people having low platelets and developing blood clots. 8 cases, and they completely shut down the entire distribution of that vaccine. If that doesn't give you confidence that someone is looking, someone is watching, someone is directly, caring about the quality and the safety of these vaccines, I don't know what will. After giving out over 100,000 doses, they had 8 people that had a problem, and they said, shut it down. Shut it down. Figure out your problem. Come back to us. That should give you an amazing sense that people are watching, people are looking out for your health and your welfare, and that these medications are safe. Once they identified what the problem was, they identified who were the high-risk candidates, and they allowed it to come back with the stipulation that you understand this could happen. These are the things to look for. These are the things, if they happen, seek medical attention. But somebody is always watching. These medications are safe. These medications are effective. When I admit my patients in the ER with COVID, I rarely ever, and I ask every single patient, I rarely ever get a patient tell me that they're vaccinated, that's someone that I'm going to be admitting. Do I see vaccinated patients come in because they're having body aches, they're having chills and such? Yes. I mean, the COVID patients are going to come. But the ones who are getting admitted to the hospital, the ones who are needing the advanced airway, the advanced oxygenation methods, the advanced pulmonary toilet stuff, those are overwhelmingly unvaccinated individuals. And it's because of these vaccinations that we're having, even though the numbers are crazy right now, especially in my home state of Mississippi, they would be so much worse if we didn't have these vaccinations.
Thank you, Brother Kinsey, for that thoughtful explanation. We have another question in the chat about hand sanitizers. Do hand sanitizers really work? And please, any of you can jump in on this one.
Let me answer that question, please, Brother Brown.
Sure.
Hand sanitizers are active temporarily. After using a hand sanitizer, approximately maybe 10 or 15 with hot running water for at least 20 seconds. That's important because hand sanitizers are not going to kill the germs completely, but hand with hot water and soap for 20 seconds, good scrub, you're better off. But hand sanitizers do work temporarily.
Thanks, Brother Scavella.
I would also add, when you think about how these things work. So hand sanitizer is alcohol-based or some other kind of chemicals agent that essentially reduces the population of a bacteria or virus on the hand. It does so by actively killing or breaking apart the virus or bacterial agent. but the carcasses are still remaining on your hands. What I do, my way of handling this is that I will, as soon as I'm near a sink, I'll wash with warm water, soap for 30 seconds or so, clear all that debris off my hands, and then in the intervening periods, I'll use hand sanitizer if they're more frequently available. But ultimately, after 3 or 4 pumps of hand sanitizer, I go back to the to washing my hands. So it's just like Brother Scavella said, it's fine for an intermediate kind of sanitization, but after that, I think hand washing is the best way to clear the debris. Also, Brother Davis, the same person who asked that last question about hand sanitizer, also asked about using more methods that are more focused on maintaining your general health. So he specifically asked about pushing eating right, physical fitness, vitamin supplementation, and so on versus drugs, using drugs or vaccines, I would imagine. So, I think that the balanced view of all of this would be to say that it is 100% the case that monitoring your overall health in and out of crises like this is the best way to defend against infection. But I have to tell you that there are people who are performance athletes, people who are in the best condition physically, who fall to this. And if you want to put all of your chips on the board behind those measures that attend your health, and no other consideration of even the basic mechanisms of protecting yourself and other people with mask wearing and hand hygiene and those sorts of things, you really are taking a risk. This virus is real. It's no lie about it. There are 600,000 and 620 some odd thousand people actually that have died from this. And not all of those people were in poor health. Some of them were in excellent health until this happened to them. So anecdotal cases here and there are fine to speak to because, everybody's experience is different. But when you're considering population level experience with this virus, it is absolutely real. It can absolutely kill you. And people who have done the best, particularly in the past few months, have been people who've gotten vaccinated, just like our Brother Kinsey said in his own personal experience. The people he's putting tubes in, the people he's clearing out the airway, the people who are begging for their lives before they get on the vent are people who haven't been vaccinated. And that's more the case now that the vaccines are available. I hope that answers the question. I recognize that there's a lot of sensitivity around the issue, but the facts are the facts. And this is one of them. The virus is real. Vaccines protect you. And, other measures, unproven, are more risky.
There was another question about people who have been vaccinated that have succumbed to the virus anyway. And I've had this discussion multiple times with patients as well as colleagues. And one of the easiest ways to discuss it that I've found is that I parallel it to wearing a seatbelt. If we know that seatbelts save lives, right? But do people who wear their seatbelts and get in accidents still die? The answer is yes. So do people who get vaccinated, can you still die from COVID? The answer is yes. But just like seatbelts, we know based on the data that you are much less likely to succumb to this virus if you are immunized in the appropriate time frame before your body sees it.
Thanks, Brother Ken. So we have one more question in the chat. This will be our final question for the evening. As part of the moderated session, it is about the booster shot. What is the reason professionals recommend it?
Go ahead.
You want to get up the hall?
I'll just say one thing that, they're recommending it because as I mentioned before, they're following the data. And part of that data is they are assessing people's blood levels of antibodies after they've been given the vaccine, after they've been developed an immune response to the vaccine component. And what they're noticing is a drop off in the amount of antibody that people are mounting as time moves on. The intention of a booster is to reactivate the immune system, to almost trick your immune system into thinking, uh-oh, this is actually showtime, the threat has come, and they will reinvest resources in producing more antibodies, which will protect you should the actual virus come. So the booster is intended to give you another stretch of immune protection as we enter, the next phase of potential wave of the pandemic. The recommendations are for 8 months for people who are immunosuppressed or immunocompromised for some reason. There are special recommendations that would qualify them for boosters now, but the booster shots aren't different in composition. They're just more of the same thing at a later date. And that's all based on evidence. The evidence is not there for J&J yet because that product came out some months after Pfizer and Moderna. And so they're waiting to see how well the immunity holds up after receiving that vaccine. So stay tuned for that information, people who got J&J.
Good deal. Thank you, Brother Hall. Brother Scavella, Brother Kinsey, Brother Hall, thank you very much for being a part of the session tonight. As we close, we want the brothers to be mindful that we have some other great topics as part of the Surgeon General's initiative coming up. These include August 26th, stress awareness and management, September 2nd, prostate cancer awareness, September 9th, travel in the age of COVID-19, and then September 16th on healthy aging. In summary, for tonight's discussions, though evolving, we know that the CDC website, the NIH website are also good sources, good reputable sources and resources for information regarding the vaccine and COVID-19 information. The COVID-19 vaccine is right now our best defense against COVID-19, along with masking and social distancing. And we also know that the FDA is providing full approval for the COVID-19 vaccine soon. So that concludes our moderated session for tonight. The brothers will be on for a little bit longer to answer questions in the chat. But thank you from the Public Health Committee of the Surgeon General's Initiative for your time, and I wish you all a good night.
Brother Woolfolk asked a question about. Should I wait to?
No, not at all. Please feel free. This is over.
Yeah.
Just to address it as you see it.
Okay. Yeah. So Brother Woolfolk asked the question: is it true that the virus attacks your protein cells in your body, and does increasing protein in your diet help in defense? Well, just in terms of terminology, there's really no protein cell. Your cells all have proteins on them. And if you're talking about the way that the virus, so when the virus is sort of free floating in the fluids of your body, it makes contact with your cells, gains entry to the cells by interacting or creating an interaction between one of its proteins on the outer surface called the spike protein and one of your proteins, which is called a receptor. I won't say the name of the receptor, but it's a receptor. So your cell's receptor binds to the coat protein, the spike protein on the outside of the virus, and that kicks off an entire reaction that causes the cell to draw the virus into itself. So it's almost like how you would reach out and grab something and put it in your mouth. It's that same sort of interaction. Once it's inside the cell, then it opens up its genome, exposes its genome for the purposes of replication. That replication period is when mutations can happen. So the way that we fight this virus with the vaccine is by generating an immune response ahead of time so that we can clear all of that virus should it come to us or when it comes to us, as Brother Kinsey said, and prevent the virus from ever entering the cell, exposing its genome, beginning to replicate, and starting the process that could allow it to mutate further. Taking in more protein in your diet isn't necessarily going to help you. There's been no studies to support that. Kind of gets back to the same question of would other measures to kind of observe your general health be protective? And I would say that I would not count on that to be the full line of this. This thing is too smart. These coronaviruses have been around well before any of us were. And it's the transfer between animals to humans that has allowed it to now encounter our system. The usual thing that happens with viruses over the course of time is that somehow we find a way to coexist with them. Or we just, do what we usually do with influenza, and we build, defenses against it by vaccination. But this is not the type of thing. Our relationship with this virus is too new. Our immune systems have not found a way to cohabitate with this thing. And so as soon as it comes in contact with it, it starts to fight. Unfortunately, it is a better fighter, smarter, and more efficient fighter than many of us seem to be. And so the only way we seem to be able to gain advantage is to build defenses ahead of being infected with this thing. So I wouldn't depend on protein shakes or special diets or keto this or anything. Just get the vaccination.
Yeah, let me address that, because brothers that are aware of the work that I do know that I am all about prevention. I talk about it all the time. An ounce of prevention is worth a pound of cure. Being ready and staying ready is better than having to get ready. So I'm right there with you in the sentiment of what you're trying to suggest. However, each of the actions that's being discussed represents a reduction of risk. And the point to be made here is that nothing is 100% effective. But I think that what you're getting at is sick care and medical treatment as opposed to preventive care and health promotion. So vaccines actually fall into the category of health prevention. This isn't waiting until you get ill and then throwing medicines at you. If you really are interested in health prevention and health promotion, vaccines fall under that category. And the sum total, this is not an either or, it's an all, both and all of the above if you're really on top of it. So you really do yourself a disservice if you try to put vaccines in a category of, oh, you're just throwing medicines at us and trying to get us to take pills. That's not that at all. I'm a very stern advocate of health prevention and health promotion and keeping yourself healthy, keeping your immune system so that when you are presented with the fight, you know how to respond to it. So, we accept that in the spirit in which it's intended. But in this example, the immunity that is conferred by vaccination is so much more robust than relying on your own natural immune system that it would actually be the equivalent of medical malpractice to suggest that you can just get away with being healthy. People who are fully healthy are falling, obviously not as much as the obese and the elderly and immunocompromised, but please do all of the above as opposed to thinking that you can just get away with one or the other. Are there other questions that you brothers want to address? I would just very quickly jump to the various comments about the booster. The recommendations have not yet been put out, so it would be premature for us to speculate on recommendations that have not yet been offered. And regarding whether or not you can interchange between Johnson & Johnson and Pfizer, we would actually defer. We will be correct to defer until those actual recommendations are made, and then we'll have plenty to say about it. For now, I think the bigger concern really is to know that we want to bump you back up to the most effective levels that represent the highest level of risk reduction, and that's the proposition behind getting a booster. It's still to be determined exactly what that will look like.
I will say that Anthony Fauci, who right over my shoulder is one of my medical textbooks that I use to learn about how to treat infection. His name is prominently displayed on the binding. He is a guru of infectious disease. What he offered as comment to that exact same question earlier this week was that if you receive Pfizer or Moderna, stay with Pfizer or Moderna. When it's your turn to take the booster shot or when you're eligible, that information will be made available. Again, if you're 8 months out from when you received your last shot, that will put you in the eligibility category, and it would just be about where you can get that next shot. It still should be free of charge, so there's nothing to be concerned about in that regard, but you should stay with the product that you had. So you shouldn't get a booster from Moderna if you had Pfizer, or vice versa. You shouldn't get Pfizer or Moderna if you had Johnson & Johnson. That was his particular recommendation. One other person actually asked the question about why is there, I think, an age delay for the vaccines. I feel like I saw that, but things have changed on the screen since then. What I'll say about that is this. So a few things, and take this home with you to your family. If you have pregnant relatives or a spouse or significant other, the recommendation was made last week by the CDC that women who are eligible to receive the vaccine should take it. There is a Johns Hopkins School of Medicine paper just released this past week about why that's safe, and they reviewed specifically the side effect profiles in a large population of women, including many African American women, and found that the side effect profile in pregnant women, women who were considering pregnancy, and those who were in the early stages had mild symptoms. So it's not, mild symptoms in the way of, aches, chills, injection site tenderness, that sort of thing that would be common to getting vaccinated. As it pertains to young people, children below the age of 12, the reason why they have not been approved yet for getting the vaccine is because no studies have been done on them up to this point that have been concluded and offered results. The studies that started for children in the pediatric population, kids like 5 or less than 12, actually started back in June. And the data from that, I don't think will probably be available until, October. Maybe some declaration of emergency use authorization will come through in the fall. But that means that if you have young children and they're headed back to school, that they are vulnerable because they have not had the opportunity yet to get the vaccine. And this Delta variant, if it's the same variant we're dealing with in December as we're dealing with now, it is very much capable of infecting children. My personal experience is that my kids go to year-round school, so they're there early in the year. They started in July. And my wife and I have just been accustomed to getting these calls in the evening from school administration saying that the health department has identified yet another person who is found to be COVID positive. And all they have to defend against that is masks and distancing and contact tracing. They do not have vaccines. So we are, always on edge, concerned about the health and safety of our kids. But that is the reason why. It's not because there's some particular deficiency in kids or whatever. It's lighter. It doesn't do as much damage to kids. It clearly is capable of putting kids in ICU level situations.
I have promised our panelists that our overtime would be 15 minutes long, but I would be remiss if I did not thank the attendees for the excellent questions that are being placed in the comments. These are insightful and very meaningful, and we appreciate the opportunity to get to some of these and not just beat down the myths that everyone has. So thank you for those questions. I do want each of the panelists to address one last question, and it is the last one actually. It says, can you discuss feedback that you've received from your day-to-day practices as to why the African American population is hesitant to get the vaccine? Fear, faith, non-believers. Would each of you mind just sharing your personal experiences? And after that, we'll wrap it up.
Well, I'll start off. In my area, a lot of African Americans who are hesitant about the vaccine because
I guess we were having some technical delay on that end. But
Why don't you take it, Dr. Kinsey?
I'll definitely discuss it. I've heard pretty much every excuse, and that's completely what I call them. I've heard every excuse you can think of as to why people have not gotten their vaccinations, whether it be fear. Haven't really heard a lot of the faith ones. I have heard some, but nowhere near the two of fear and just non-believers. The fear is hugely pushed with just misinformation. It's people believing things that they're reading online and it's swaying them away from the virus. Anything from vaccination causes sterility, and they won't be able to have a baby. I've seen multiple of those cases. That I've actually had people tell me that they think that the vaccination is an implant, and this person was educated young man. He wasn't someone who was just off his rockers. He really believed that someone wanted to track him. And I tell him, I was like, well, just look in your pocket, look at your phone. That thing is a better tracking device than anything that anybody could inject into your arm. I promise you. And some of them are just the non-believers, the ones who honestly believe they're just not going to catch it. I'm going to be fine. If I catch it, I'll be fine. And statistically, you're right. Statistically, that you probably will be okay if you get COVID. But what if you don't? What if you end up with a very bad case? What if you're in the hospital alone? Because that's how COVID patients are. They don't get to have family members to come and check on them and bring them things and sit with them and hold their hands. Those COVID patients spend days, sometimes weeks in the hospital by themselves. They become best friends with the nurse that comes in their room, that they can only see her eyes and her eyebrows because she is completely garbed up. She's got on a mask. She's got on a face shield. She's got her hair covered. She's got a plastic gown on to protect her from getting any kind of spills or anything else on her. So for 2 weeks, 3 weeks, 4 weeks, however long it takes to have a patient in the hospital with COVID, and sometimes it can be pretty extensive, that becomes your best friend. You don't have anybody else. That's it. That is the only physical human touch interaction that you're going to have, is that person that's coming in and checking your temperature and your blood pressure every day, or advancing your airway support because you're getting worse and you're getting sicker. And that's how I tell people. People are always asking, well, for my mental health, what can I do to help you out, doc? And I know you're treating people all the time. What can I do to help you? You can help me by being an advocate for getting vaccinated. That's how you can help me get more people, to get vaccinated. And how can you do that? If you know someone that's had COVID, especially ones who have had a very tough time with COVID, get those people to speak up and speak out, because those are the ones who can possibly change the minds. I can tell you all day what I see, but I can't tell you what it feels like because I haven't had COVID. I can't tell you about the loneliness of being in a hospital for 7 days, for 10 days by yourself. I can't tell you about the pain that, even though I can see it in people, I can't tell you what that pain is like. I can't be the one that grown man that's like crying because his body aches so bad. I can't, describe that to you in the detail that person can. So if you know people that have had, terrible situations with COVID, get them to be our advocates, get them to speak up, get them to speak out, because those are the ones who can truly change some people's minds. When I hear these stories, even though I see them all the time, when I hear them, it makes me want to just go get an extra shot. Just give me one more. I mean, I know I got two, but just stick it one more time, just, to cover some bases, because those are the stories that really impact people. When they hear these things, it really changes you. I promise you, if you listen to some of these stories on how people suffer with this virus in these hospitals, it will change you and it will make you want to go get vaccinated if you already aren't.
Brother Scavello, you want to try again?
Thank you. In my practice and situations, I've experienced a lot of patients who have been hesitant about the vaccine because of the fact that they don't believe in it, and they've been going by anecdotal misinformation that they've been hearing other people talking about. And the only thing I can do is sit and listen to them, and had both shots, and I've had some of the mild side effects, but other than that, I feel fine. And I'm a prime example of what they would experience if they get the vaccine. But this misinformation is out there, and until they see a relative or somebody that's hospitalized or somebody close to them that's been infected by the COVID, is when they actually have a change of mind, because they feel that they're not going to get this, and it's something that a lot of people believe it's no different than getting the flu. And I try to explain to them not the same thing. The side effects are worse. And as Dr. Kinsey was elucidating concerning the hospitalization, when I see patients that have been hospitalized or those that have experienced hospitalization, even when you're talking to them and they talk, explaining to you what the effects have been, and the loneliness, as you said, as you talked about before, is very, very key. So we have a ways to go, but I think we can cover this and we can actually be more positive and reach more people in the African-American community.
Thank you, Brother Dr. Hall.
Yeah, I don't think I can offer comment that's any different in that regard. What I will say is that, a couple of comments that have come up in the chat about potential for shutdowns and should people be in these large community gatherings like sporting events and that sort of thing. What I would say is you have now taken in all this information from people who are actually dealing on different levels with the situation. We have all kind of brought to the table information that is evidence-based. And hopefully what you'll take away from it is not just following specific guidelines, but more or less a common sense approach to handling yourself in this unfortunate situation. I would say that I don't know about the potential for shutdown. I can tell you this: if we shut down intentionally for 3 months, and in that period of time, people were diligent about getting vaccinated, we come out on the other side and it's like this never happened in the country. If that's what we could accomplish together, we would kill this. We would knock it out. The only reason it survives is because it has a place to go. And people who aren't getting vaccinated give it a place to go. As long as it has a place to replicate, it has a place to mutate. If it mutates, then it has more power to cause damage when it finds its next victim. And eventually, it will overwhelm the defenses that we've built up through our ingenuity. This thing can shuffle its genome very quickly. It takes us forever to evolve to the threat. So I would say that, we are fighting an enemy that's changing, that's learning, that's smarter, that's faster, more efficient than when we first saw the virus. And there's no reason to believe that it will stop on that trajectory going forward. I just urge everybody to think carefully based on the evidence, good sources of information that are reputable, and make a decision that best suits you, but also keeps in mind the potential impact on the society at large. You may not like your neighbor, you may not care about their health or well-being, but in this particular situation, their health and their well-being directly impacts you. And this is a game of time and odds. I don't think that it's safe to waste any more time or to play the odds with this type of threat. It's just too intelligent and too rapidly evolving. So I encourage you all to get vaccinated. Please carry this information to other places. Try to convince people who haven't made up their minds yet to make up their minds, at least introduce them to the CDC website. And thank you for attending.
Thank you, everybody. And I'll have the last word on this. This really is about the intersection of risk reduction and whatever levels of compassion and empathy you have. The water will settle on what you perceive to be your individual risk and your inclination to engage in best practices that help keep you safe. Staying ready, preparing so that you don't have to get ready once you become ill. Being healthy so that when presented with a challenge such as COVID-19, you can come out on the other side okay. That's why you get vaccinated. That's why you mask. That's why you social distance. That's why you allow yourself to be part of contact tracing if necessary. Again, the other part of the conversation really is how much do you actually care? This disease is going to stick around. We have been dealing with influenza for 100 years because of many of these same considerations. The pandemic from a century ago is still here, killing tens of thousands of individuals a year. You have to have sufficient compassion, and I could not agree more with the notion that this could have been and this could be eradicated if we simply engaged in what was necessary for a matter of months. Don't ever forget that. We have to not be as frustrated as we are resilient to do our parts. So take that with you and please consider the source where you get your information. I hear so much about I heard or a doc said or a healthcare worker. No, consider the best practices from the best sources. And if you have access to someone who is actually a subject matter expert, feel free. We're all here. We're not trying to be right. We're trying to get it right. Don't confuse the notion that we don't know what we're talking about, because the data and the research actually evolves. You are witnessing how the sausage has been made historically in terms of how research occurs and how guidelines and science and knowledge occur. You've just been involved at the beginning of the process. It's not always pretty, but it is the scientific method, and that's what we're here for. I want to again thank you for participating and actually sticking around for the overtime. A huge number of you guys stuck around for this, and I do appreciate that. Come back next week, where the Mental Health Subcommittee of the Surgeon General Initiative will moderate our next topic, which will be stress assessment and management. And obviously, in this era, in the midst of a pandemic, that's a vital topic. So come on in, we'll give you some helpful tips as to how to manage stress and how to recognize it. And thank you once again. And with that, I will bid you good night.